Adult and Child Center started probably in the 40s as a specific child-based service, and it grew as time went on to include adults. The niche population that we serve are those with severe and persistent mental illness as adults, so they are substantially impaired with a mental health illness of some sort. That has changed over time. Now we serve some folks with Axis 2, which is more of the personality disorder type situations, and we've definitely grown with integration of health care to try and reduce the early onset of death, the death rate for our adults. They seem to die at least 20 to 30 years younger than the average American. Typically, individuals with mental health illness are underserved in our community. They're not seen as serious when they go to the doctors and complain about health conditions, perhaps because they have complained for so many years about different things that weren't real. So when they are real, it's comparable to a metaphor, the Peter calling, the boy calling wolf. So what happens is, I think when they typically do have a treatment that they need, they might not be taken seriously, and by the time they realize it, it's too late, or they've given up. I also believe that people with mental health illness it's a hidden disability, and it's a disability that not only carries along stigma in general, but it carries a lot of fear. The typical perception is that someone with a mental health illness is dangerous or scary, or they don't understand it, even though they're probably related to someone or working right along someone who suffers from depression, or hearing voices or different things that are downplayed. So I think that if more people were not so afraid of folks, that they would be embraced in the community, and they would be working, and they would have had insurance, and they would have had better health care, and they would have been seen as contributors and perhaps treated and taken more seriously when they go into the physician. They also tend to be overweight at times because of their psychotropic medications or the side effects of not wanting, avolition, not wanting to be active or be motivated, or so depressed that you fail to get out of bed and take care of yourself and brush your teeth, and you have poor dentition, and I think a lot of that has to do with it as well. They have bad healthy habits. A lot of folks self-medicate, so those young kids in college, they might not be just partying, they might be dealing with their symptoms as best they can, being away from home and not having the supports in college, so they drink or fail in school and are disregarded. There have been a lot of changes in our field over the years, and every single change has been feared, and every single change we have triumphed. I believe that there is a huge passion with the people that work in this field, and we figure it out. I believe that Social Security has made great strides to help people realize that there are work incentives. I believe our state in particular has embraced that. We started with the Benefits Information Network, and we were one of the pioneer states to, incorporate benefits counseling as a role of an employment counselor, where it was just an assumed appendage before that. So the education that was provided through a grant that started through the MIG grant, or the Medicaid Infrastructure Grant, and pioneered by Becky Banks and a benefits coalition that really worked hard to help people understand. That was a huge change, and I still see a lot of really good things coming from helping people be as self-sufficient as possible. I truly believe that the ticket to work, although rolling that out has has seen its own hardships during that change, but I'm starting to see a lot of success through that program for people that may not have typically wanted to go through the traditional hoops to return to work, but needed a leg up or needed someone to talk to.